All right, diving in today. Clinical reasoning. Big topic, right?
Huge. Absolutely fundamental to how healthcare works.
Exactly. And we're going deep with this 2024 article, The Inseparability of Context and Clinical Reasoning. Olson and whole team behind this one. We often picture doctors as these like lone geniuses making diagnoses in a vacuum.
Yeah, the classic medical detective image. Gathering clues, putting the pieces together.
But this article, it's like, whoa, hold on. It's saying the whole healthcare ecosystem, everything around that clinical decision matters just as much.
It really flips the script. It's not just what's in the clinician's head. It's the people, the tech, the whole environment.
So today's mission, unpacking that, why context is so crucial to how healthcare decisions actually get made.
And what that means for all of us, really, whether we're the patient or part of the system.
Okay, so rewind a bit. How did we even get to this idea? What were those early models of clinical reasoning?
Well, you had the classic hypothetico-deductive model.
Yeah.
Like very systematic, almost like a scientific experiment. Doctor forms a hypothesis, then gathers data, tests it, boom, diagnosis.
Very logical, step by step.
Right. And while that kind of reasoning exists, it's not the whole picture.
Yeah.
It doesn't quite capture the messy reality of clinical practice.
Then came things like script theory, right?
Yes.
Bringing in the role of experience.
Exactly. Script theory, it's about recognizing patterns. As clinicians see more patients, they build up these mental scripts for different conditions. Certain cues trigger those scripts, and it speeds up decision-making.
Makes sense. Like the more you've seen, the faster you recognize things.
But even that doesn't account for how the specific situation impacts things. Which script gets pulled up, how it's applied.
And then the big one, dual process theory. That's system one, system two thinking. And the article points out there was a bit of a bias there, wasn't there?
Oh, definitely. For a while, it was all about system two, that slow, analytical, deliberate thinking. And system one, that fast, intuitive stuff, was seen as, risky, prone to errors.
Like, don't trust your gut, doctor.
Kinda, yeah. But, we see now that expertise, true expertise, often relies heavily on system one. Think about an experienced radiologist. They see an X-ray, instantly spot an abnormality. That's not slow, step-by-step analysis.
More like pattern recognition honed over years, right?
Exactly. And this focus on individual cognitive bias as the main driver of errors, it misses the mark, misses the fact that the system itself, the interactions between people, play a huge role.
So, context. If it's not just about individual thinking, where does it fit in?
That's where situated cognition theory comes in. It's saying a doctor's thinking isn't happening in isolation. It's shaped by the patient right in front of them, the environment they're both in.
So like the resources available in the clinic, how urgent the situation is, the patient's beliefs, all of that.
All feeding into the process. And the article takes it even further. Context isn't just an influence. It's actually, they argue, core to how clinical reasoning unfolds.
Wow, so not just influencing the process, but actually at the heart of it.
They make the case that context is the very basis, the epistemology of clinical decision-making. One quote that really stuck with me. Context is everything.
Powerful stuff. But how do we even study something so big, so complex?
That's the challenge, right? Traditional medical research, it likes to control variables, isolate things. But context, it's messy, it's dynamic.
Not easily captured in a lab setting.
Nope. So we have to look to other fields. Social sciences, anthropology, methods that help us understand the real-world interactions within these clinical environments.
Observing, really digging into the culture of a hospital unit, things like that.
Exactly. We need a more nuanced approach. Now, when we say context, what are we even talking about?
Yeah, good point. It's such a broad term.
The article gives a pretty comprehensive definition. They call it a dynamic and ever-changing system that emerges from underlying patterns of patients, locations, practice, education, and society, and from the unpredictable interactions between these patterns.
So lots of layers there.
Right. The patient themselves, their background, the healthcare setting, the routines, the training of the staff, even societal factors like policies, cultural norms. It's all intertwined.
It's like this constantly shifting web of influences.
And it contrasts with how context has been sometimes kind of narrowly defined in research, like focusing only on how similar a patient case is to previous ones, or just the doctor-patient interaction in isolation.
Ignoring the bigger picture.
Yeah. There's this work from Bates and Ellaway in medical education that tries to break down this idea of context. They came up with 4 key concepts.
Okay, lay it on me.
First, context as the physical location. Literally, the environment where care happens, the resources available. Second, what actually goes on in that location, the workflows, the typical interactions. Third, what each participant brings to the table, their knowledge, skills, beliefs, even their past experiences. And lastly, the broader cultural influences, values, norms, even political and economic pressures that impact the healthcare system.
So it's not just about the individual anymore.
Right, it's about the whole system. And the key shift is seeing context not as something to remove or control for, but as fundamental to how clinical reasoning works.
This makes me think about the variation we see in practice. Doctors in the same field approaching similar problems differently. Is that all just individual skill, or is context playing a role?
The article suggests context is a huge factor. We often assume it's about individual knowledge or following guidelines, but maybe those deviations aren't always failures.
Meaning, a doctor might intentionally choose a different path based on the specific situation.
Precisely. They might have good reason to diverge from standard recommendations. Maybe a guideline doesn't fit a complex patient, or there are resource limitations. There's even the question of, say, choosing a less expensive, non-evidence-based medication for a patient who can't afford the ideal option. Is that bad care, or is it being responsive to their circumstances?
It challenges that idea of guidelines being absolute, regardless of context.
It really does. And this aligns with fields like quality improvement, QI, and knowledge translation, KT. They explicitly recognize the importance of local context. What works in one place might not in another.
So it's not just about the knowledge itself, it's how it's applied in a specific setting.
That's the essence of clinical reasoning within a health system, as the article puts it. And there's some interesting overlap with fields like business and operations management.
Really, I wouldn't have expected that connection.
These fields have always known that human behavior, decision-making, it's all influenced by the situation. Workload, team dynamics, resources, it all matters.
Yeah.
There's even the idea in business that when hiring, you should consider how similar the candidate's previous work environment is to the new one.
Makes sense someone who thrived in a similar context might do well again.
The article highlights how in medicine we often try to strip away context, especially in education and assessments. But if it's so important in real practice, are we missing something crucial by doing that?
Are we measuring the wrong things, basically?
It's a valid question. This awareness of context also changes how we think about patient safety and even legal issues.
Huge implications there.
Definitely. In patient safety, there's been a shift away from blaming individuals towards understanding the system, the context of an error, designing better systems that support good decision-making.
So less about be more careful, more about, how can the system help prevent errors?
Exactly. And in medical legal situations, the standard is often what a reasonable medical practitioner would do in all the circumstances.
Yeah.
That inherently recognizes context, even if it's after the fact.
So context is baked into the legal thinking, too.
Yeah, having a deeper understanding of the specific context of an incident could lead to more accurate, fair assessments.
Okay, so if we accept that context is crucial, how does that change how we study clinical reasoning going forward?
We need to move towards studying it in situ, in the real world, not in artificial settings. Embrace the complexity, use methods that capture those interactions.
No more removing people from their actual work environments.
Right. Qualitative approaches like focused ethnography become super valuable. Researchers immerse themselves in specific settings, observe things like handovers, rounds.
So really getting a feel for the environment.
Yeah. The article mentions Chopra's work, using this method to show how fragmented data flow in a hospital impacted diagnoses. That's something you'd miss in a controlled study.
You can't recreate that complexity in a lab.
And mixed methods research, combining qualitative and quantitative data, also becomes crucial. There was a study, a large one, that found doctors' subjective ratings of patients with atypical symptoms were predictive of errors. Again, a real-world insight.
You need those real-world studies to capture those kinds of things.
Simulations still have their place, but they can't fully replace studying clinical reasoning in its natural habitat.
All right, last big piece here, education. How do we train future healthcare pros with this understanding of context?
If context is fundamental, then health system science needs to be front and center in medical school, right alongside basic and clinical sciences. We can't teach clinical reasoning as this abstract thing, detached from the realities of the system.
So less classroom, more hands-on, earlier in training.
Ideally, yeah. Learning within the system, in the community, with interprofessional teams. And we need to show learners real-world data that demonstrates the variability across different contexts, help them develop that nuanced, context-sensitive view.
So it's not just about knowing the guidelines, it's knowing when and how to apply them in different situations.
Exactly. It's about preparing them to be adaptable, effective clinicians in the real world.
Well, this has been a fascinating deep dive. For our listeners, what's the big takeaway message here?
Simply put, context matters. It's not just background noise. It shapes how clinical decisions are made. The modern healthcare system, the unique circumstances of each patient, it's all integral to understanding how clinical reasoning actually happens.
We've talked about some pretty big shifts in thinking, haven't we? From individual to system, from trying to eliminate context to embracing it, from blaming individuals for errors to designing more resilient systems.
Absolutely. And it brings us to a final thought for you, our listener. Knowing how powerful context is, how might being more aware of it empower us all, whether we're patients navigating the system or members of the healthcare community? Could that awareness help us contribute to safer, more effective, more equitable care? It's a question worth pondering.
It is. And on that note, we'll wrap up this deep dive. Thanks for joining us, and we'll see you next time.